Yes, ma'am.
Okay, so we shall be
Yes,
starting
ma'am.
then. So the topic of our discussion will be the hepatotoxic drugs. The thing is that this is a very short topic, and all you have to understand from today's session is that you will have to know what are some of the list or some of the examples of hepatotoxic drugs, and also some of the mechanisms relating to the hepatotoxicity with those drugs. Okay. So, coming to the overview with the liver, as we all know that liver is one of the largest organ in the body, and they have diverse functions. The main function being the detoxification of toxic metabolites, and it is the primary site for the metabolic process to occur. Coming to pharmacology, what is happening here is that a drug is a xenobiotic. No, so xenobiotic means it is a foreign compound. So as a foreign compound, the drugs needs to get eliminated from the body, and if it is not eliminated from the body through the process of excretion, then it's going to remain in the body for a longer period of time. And if that is happening in the course of the drug, then what will happen is there is going to be some kind of unlikely and exaggeration of all those toxic effects. So one of the functions of the liver in this kind of excretion process of drug is that the liver is the main organ where drug is undergoing metabolism. So if for this you have to remember your pharmacokinetics lesson, in which after the drug is administered, distributed to the whole body before going to excretion, they are undergoing the process of metabolism. Okay, I hope all of you remember that process. Okay, so liver is one of that important organ which is exposed to most not every but most if not all the drugs. And there are two phases under which the metabolism mainly occurs in the liver, there where your phase 1 reactions and phase 2 reactions, which makes the drug very ready for your excretion process by making it lipid insoluble, so that they are not further reabsorbed in the body and are made very much ready for the excretion out of the body. And the liver plays that important function here in the metabolization of the drugs. So we can say that the main function, if you are saying it to the drugs, the main function of the liver cells will be to detoxify the drugs. That is to make the drugs undergo metabolism and make them ready for the excretion. So many drugs, when metabolized, they produce active metabolites, which might be toxic, and this most cases, the liver is able to neutralize these metabolites and convert them to non-toxic products, so that the body is free of those non-toxic products that is generated from the metabolism of the drugs. But there are certain cases, okay, there are certain cases in which the exposure of those toxic products from the drug is not inevitable. So this would be your first thing will be in when the excess of dose is taken. So this is mainly true because your metabolizing enzymes in the liver, they are of certain capacity only. Okay, there are certain numbers and there are certain capacity for the drugs to get metabolized. But if you are taking drugs at a very higher doses, what is the thing is going to happen is the excess of the metabolite products or the toxic products, which will not be metabolized because of the restrictive functions, or because of the limited, let's say, the limited number of the metabolic enzymes the liver will have. Next thing is when there is liver damage. Obviously, when the liver is damaged, your the function of the livers will be critically impaired. Okay, so in that case, also what will be happening is that the drugs generating the toxic metabolites will not be fully metabolized, and therefore the toxic metabolites exposure will be much more higher to the body. And also when we use the drugs which induce the hepatic enzymes, So more of the induction of the hepatic enzymes mean more faster will be the metabolism. More faster metabolism means more of the excretion. But when the metabolism is getting faster at a very faster rate, there is high chances that the toxic products metabolism is is not at a very dignified stage. In that thing also the toxicity will increase because the metabolites here means the toxic products that is formed from the metabolism of the drugs. It will overwhelm the hepatic cells, and therefore the hepatic damage will take place. So this is how your process of your toxicity to the liver, mainly because of the use of the drugs, can prevail, and that is called as your hepatotoxicity. So it is nothing. The hepatotoxicity, as the word suggests, it is the toxic effect or the adverse effect to the liver functions because of the use of drugs. And basically, there the hepatotoxicity due to the use of the drugs, it can be divided into three types. One is called as direct toxic type, which is a dose-dependent effect of the drugs on the liver function. And next is the immunogenic type. Immunogenic means relating to your immunity of an individuals, where drugs because they are foreign particles, they can act as an immunogen, or let's say an antigen, and can react with the and can form reactions, can come across, and therefore leads to an immunogenic type of reaction. And next, third one is the idiosyncratic type, which is generally, if you see the definition of idiosyncrasy, you know that it is a genetically defined abnormal reaction by a body. Okay, so this is mainly seen in particular population of the individuals who are genetically susceptible to produce the toxicity because of the use of the drugs, mainly to the liver. So coming to the direct toxic type, I've said you that in this type of hepatotoxic effect by the drugs, there is actually the direct damage there is actually the dose dependent. So if you go on increasing the dose, that will have a dose dependent effect on the liver tissues, and it results in morphological abnormalities mainly. So next is your immunogenic type. So in this type, there is a kind of development of series of antigen antibody reaction, mainly because your drugs, they will act as an antigen because they are foreign particles and will identified by the body as an antigen. And when they form a certain kind of adducts with the liver proteins, they will run a full-fledged kind of your antibody production, and because of that, this is called as your immunogenic type. And contrast to the direct toxic type, this is not related to the dose. So these are your type B kind of adverse drug reactions done to the liver. They are not dose dependent and may appear shortly after even the brief exposure to the drugs. So this results in hypersensitivity reactions like rashes and eosinophilia. Next is the idiosyncratic type. This is your genetically oriented kind of reaction shown mainly to the liver. Okay, so it results from genetic or acquired variations in drug. Mainly the related to the drug is the process of your biotransformation. So biotransformation is again your metabolism of the drugs with synthesis or abnormally so detoxification of the hepatotoxic metabolites. So, if that is clear, then hepatotoxic drugs, what you have to learn here is the list of at least 5 to 10 number of your hepatotoxic drugs. So mainly your drugs that cause hepatic damage in overdoses will be a drug called as paracetamol. So can you remember what is paracetamol? To which group is paracetamol belonging to? Which therapeutic group?
NSAIDs.
So KIDs. Okay, so these are hepatotoxic in overdoses. Then you have salicylates, aspirin. These are also your NSAIDs group of drugs. Then you have tetracyclines. So tetracycline, your NSAID belongs to which therapeutic group?
Antimicrobial.
Which group of antimicrobial would it be?
Broad spectrum.
Sorry.
Broad spectrum. And
So that is your broad spectrum antibiotics. Okay. So next is your androgens. So androgen, probably you will be dealing in your next block for MBBS as well as BDS. So these are a reproductive group of drugs. Okay. So OCP means oral contraceptive pills, which are the pills taken to prevent the pregnancy and all. So rifampin, which drug is this?
antitubercle,
antitubercular.
Antitubercular drugs. Okay, so there are also the drugs which can cause the hepatic damage at therapeutic dose by hypersensitivity reaction. So it was clearly mentioned in your three types of hepatotoxicity that one of the type is immunogenic type. So by hypersensitivity reaction, the drugs causing such hepatotoxic effect is known as a halothane. Okay, so halothane, you're not familiar with this drug. Halothane is actually a drug belonging to a general anesthetic. These are the drugs which are actually administered before a major surgeries are to be done. Okay, so this makes a person unconscious or sedate the patient as required by the surgery. So this again, you will be learning about this drug in your CNS block. Okay, so for now, you just have to remember the drug name. Now, next is your continued therapy. That is for a very chronic use of the drugs. The drug can also prove to be hepatotoxic. The names of the drugs under this category are your methyl-dopa. So methyl-dopa is which drug?
Anti-hyper.
So that is your antihypertensive drugs, which is mainly used in the pregnancy-induced hypertension. Okay, so isoniazid, it is your
Antitubercular.
antitubercular drug. So you know that most of the antitubercular drugs, three out of five of those first line antitubercular drugs, they are actually hepatotoxic in nature. Okay, so alcohol, these are kind of your rubificient and also these are CNS depressants. Okay, next is your methotrexate. So these are your immunosuppressant drugs. So some can cause delayed type of hepatic damage even after the stoppage of the drugs. Okay, they are your high dose of anabolic steroids. So these are anabolic steroids are again your reproductive drugs, which are kind of drugs of abuse also, where the athletes, mainly the athletes for the high them. So this falls under your reproductive group of drugs. And also oral contraceptive pills can use for more than 5 years can also cause the hepatotoxic effects. So you see, the hepatotoxic drugs can be like not only in one category, they can be there for different categories also. So types of hepatotoxicity cause, and the main category was three types, where you have the direct toxic type, the immunogenic type, and idiosyncratic type. And if you elaborate this categorization again further, okay, you can see several types of hepatotoxicity caused mainly due to the use of drugs. So one is your hepatic cell injury, which is like your direct type of toxicity caused by the drugs. This is kind of direct overt damage that is caused to the liver cells. Okay, and the one that is causing them is paracetamol and phenytoin. So phenytoin, you might not be knowing about these drugs because this is a drug known coming under your anti-epileptic groups. Okay, so these are the drugs which are used to control seizures and fits in the pregnant women. Okay, patients of coming to you in detail in your CNS block. So next is your cholestatic jaundice. Okay, in this case, what is there is the drug. It causes the interruption in the bile flow, because of which there can be increase in the bilirubin level. Okay, so that will lead to a jaundice-like features or symptoms, and that is known as cholestatic jaundice. So drugs causing them are chlorpromazine. So this is an antipsychotic drug. You know about rifampin, erythromycin, and androgens. So hepatitis, we all know that is this is inflammation of sorry, inflammation of the liver, and the drug causing it is example. One of the example is isoniazid. So next is a condition called as fatty liver, which is also known as steatosis. Okay, so this is a condition in which your fat or your lipids gets accumulated inside the liver cell, mainly due to the abnormal retention of the liver in the cell. Okay, so due to some reason, the lipids get retained inside a liver cell, because of which there will be accumulation of these kinds of lipids, let's say the fat in the liver cells, and that is why they are given the term the fatty liver, because of the abnormal retention of the fat in the liver. And the drug giving such symptoms are your tetracycline. Next is cirrhosis of liver. All of us know that this is a kind of your chronic liver damage. Okay, so this is usually seen mainly in case of alcoholism. In this situation, what is happening is there is chronic damage to the liver cells. Okay, they are replaced by non-functional cells, because of which the liver will become non-functional. So this is kind of end stage to your liver function. So cirrhosis of liver. Next is your immunologically induced hepatitis. Again, here the drug will act as an antigen, forms adduct with your liver proteins, and initiate a full-fledged kind of immunogenic reaction by production of the antibodies, and the series of antigen antibody reaction will cause the damage to the liver cells and function, and that is called as the immunologically induced hepatitis. The drug giving that is halothane. So halothane is your general anesthetic drug. And the other one is your hepatocellular carcinoma, which is your formation of cancerous cells in the liver. Okay, so these two drugs from the reproductive system, that is your anabolic steroids and oral contraceptive pills, can have such effect. So that was the list of some of the important hepatotoxic drugs. So what you also have to learn is some of the important mechanisms through which the drug can cause toxic effect to mainly to the liver function. So that will be your ethanol. Okay, so ethanol mainly these are belonging to a group called as alcohol. So ethanol, these are used also for your treatment of methanol poisoning. So ethanol bandakari, alcohol bandakari, it's just not that this is you. They also, I mean to say is that what I mean to say is that they also have some therapeutic purpose, where they are given for the treatment of methanol poisoning, and also act as antiseptics or lubrication, that is relieving of pain through rubbing in the affected areas, or counter irritant for sprains. Okay, so what you have to learn here is how ethanol becomes a hepatotoxic drug. So this is all because of the redox changes. Okay, redox changes that is occurring because of the metabolism of the liver inside the cell. So what is happening, ethanol with the enzyme known as alcohol dehydrogenase, they are metabolized into a compound called as acetaldehyde. Okay, this is the main process through which your metabolism of alcohol, sorry, not alcohol, the ethanol is being there inside the liver. Okay, so when they are getting metabolized to acetaldehyde, there are some redox changes happening around. Okay, so simultaneously what is happening is your NAD that is getting converted into NADH. So this is the redox change that is happening, and with the production of alcohol, NADH, what is happening is that it is activating an enzyme called as xanthine oxidase. Now, xanthine oxidase, they are very much reactive. Sorry,
मैम रिकॉर्ड भएको छैन
wait a second. Wait. Something might have went wrong because मैले first गरेको थिएँ record. Okay, thank you. Whoever said that. Okay, can you see the slide?
yes ma'am
Okay, so I was talking about how ethanol is proven to have the hepatotoxic effect. Okay, so what is happening inside the liver when the ethanol undergoes a process of your metabolism with the influence of the enzyme called as alcohol aldehyde dehydrogenase. So they are giving you acetaldehyde. Okay, so in this process, simultaneously your redox changes will be happening where your NAD gets converted into NADH. Okay, so NADH, they are kind of influencing an enzyme called as xanthine oxidase. So xanthine oxidase, these are very reactive kind of enzymes which are responsible for production of superoxide. So superoxide is a very, you can say these are reactive oxygen species, and they will be mainly responsible for a process known as lipid peroxidation. So what is lipid peroxidation is, you see in a cell, we are particularly concentrating here in the liver cells. Okay, so liver cells, you see the cell membrane is mostly a lipid bilayer. Okay, so the process of lipid peroxidation means it is the oxidative degeneration of the lipids. So simply, if you say, it is the process in which the free radicals, that is from the superoxide, the free radicals are getting present in those layers of membrane. What is the consequence of this is that with the process of lipid peroxidation, the cell membrane is getting dysfunctional, or there will be alteration in those lipid bilayer of the cell membrane because of the process of lipid peroxidation, and therefore the cell membrane will be destroyed, or maybe let's say destructive cell membrane will be there, and because of which there will be an easy hepatic cell damage. So simultaneously, there is also an alternative pathway in which the ethanol oxidation in liver microsomes will be carried out by a set of enzymes known as your CYP2E1. So I hope you remember this from your metabolism of drugs, where your cytochrome P450 groups of the enzymes are mainly responsible for many of the metabolism of the drugs. So do you remember that cytochrome P450 enzymes in the liver, which is actually metabolizing the drugs? Okay, and ethanol can be metabolized from both of this pathway, that is from ADH as well as your CYP2, the main one being the metabolism from the ADH. Okay, so in both of the pathways, what is similar is that they will be giving they will be producing the superoxides, that is your reactive oxygen species, and these superoxides will be responsible for a process known as lipid peroxidation. So do I have to repeat what lipid peroxidation is? Have you understood what is the process called lipid peroxidation? Or do I have to repeat it again? Are we there, students?
yes ma'am
Okay, do I have to repeat this lipid peroxidation, or you get this thing? Okay, so lipid peroxidation, okay, it is the oxidative degeneration of lipids. So what is happening is that in a cell membrane, it is a lipid bilayer. Okay, so with the process of lipid peroxidation, it degenerates the lipids. Okay, that is, it steals away the electrons from those lipid bilayers so that the lipid membrane is destroyed or they become dysfunctional. Okay, so because of that, your liver cells will get damaged. Okay, this is how they lead to hepatic cell damage. So other way around, if we see, okay, the acetaldehyde, which is the major metabolite from ethanol, they are also responsible. They are also responsible for forming the adducts. Adducts means your acetaldehyde or your metabolites from the ethanol. They can combine with the cellular proteins or the liver proteins, and they can behave as an antigen. Okay, and this will start a initiate or immune response for the production of the antibodies, and therefore through the process of your immunogenic type of hepatotoxicity also they can have the hepatocellular dysfunction, but the main mechanism is through your process of lipid peroxidation. Okay, understood? Students, understood?
Yes, ma'am.
Okay, so next is your a drug known as paracetamol. So MBBS students, they have already gone through this NSC ideas, but with the BDS students, you still haven't studied about this. So you'll be doing this in your fourth semester only. Okay, so as all you must all know that this is a household drug, which is a non-prescription drug also, which is there mainly for the treatment, mainly as an analgesic or mainly as an antipyretic drug. Okay, and they belong to a family of a therapeutic group called as NSAIDs, that is your non-steroidal anti-inflammatory drugs. It is so don't worry. Just we have to just know about its mechanism of toxicity. So this have already been learned by the MBBS students in their NSCIDS classes, that what kind of how a toxicity prevails with the use of the paracetamol. So can the MBBS students answer? So in what case the paracetamol toxicity is very common to the liver? Is it in the therapeutic dose or in overdoses or continuing to use or what?
Overdose.
Overdoses. Okay, we still remember that. So this is causing the toxic effect to the liver in the overdose mainly. Okay, so 500 mg SOS dose is the therapeutic dose, but if it is exceeding 2 kg or 5 kg beyond that, that will become an overdose. So what is happening at therapeutic dose, paracetamol is converted into a metabolite called as NABQI, that is your N-acetyl-p-benzoquinone. And NABQI is very chemically reactive substance, and it is detoxified in the liver by a process called conjugation, which are your phase 2 reactions, mainly with a compound called as glutathione. Okay, so this is a detoxification process through your conjugation reaction in the liver. But when you take paracetamol in a very higher doses, so this means your higher doses of the paracetamol will equally proportionate will be more of the NAPQI form. That is, more paracetamol being taken means more NAPQI will be formed. But your capacity of the liver for the glucuronidation with the conjugation with glutathione process is a very limited function, and because of that the process of the glucuronidation capacity will be saturated, and those of the excess NAPQI which has not been able to be detoxified through this conjugation with glutathione, what they now do is that they will now bind covalently with the liver proteins, and they start damaging the liver, and that they land the liver lands up in the liver necrosis. Or let's say, you don't have to be specific about the type of toxicity. You just can say it will be having a hepatotoxic effect, because this NABQI will now be binding to the liver protein and start damaging the liver cells. So can you guys remember what was the antidote given for the paracetamol toxicity? How was it managed?
Acetylcysteine.
Yes, yes, the drug given not was not the antidote. Specific antidote for your paracetamol toxicity is your N-acetylcysteine, and they work by replenishing the glutathione stores for the liver, and also prevent the binding by preventing the binding of the NABQI with the liver proteins. Okay, other symptomatic treatment will be induce vomiting or gastric lavage, so that they further prevent the absorption of the drug. And also activated charcoal is given orally to prevent further absorption. But what you have to remember will be the specific antidote to the paracetamol. Okay, so this might be asked during your viva questions or even in your MCQ types of question. So next is the isoniazid, which is an anti-tubercular drug, and they also have a hepatotoxic effect. So the mechanism of toxicity will be your enzyme called as amidase will be first converting the isoniazid in the liver to a compound called as hydrazine, and with the set of your cytochrome P450 enzyme, they will be converting it to the toxic metabolite. Now, this will be binding to the liver proteins again, and they can cause the hepatocellular necrosis. So you see, there is a process which is very common in all those toxicity mechanism, that inside the liver, they are like being metabolized, getting converted to a toxic metabolite, and either they will initiate a kind of immunogenic reaction or can directly bind to the liver protein and start damaging the liver cells. Next, anti-tubercular drug known as rifampin. They can show dose-dependent kind of your hypersensitivity, not dose-dependent hypersensitivity. But what I mean to say is that they can have two different type of hepatotoxic effect. So with the large intermittent doses, it has been found to produce the hypersensitivity-induced hepatotoxicity. So if you elaborate this type of toxicity, what is happening is here is rifampin can act as an antigen. So they will be producing the reaction, chain of reaction, antigen antibody reaction, so that can damage the liver. So that will be your hypersensitivity induced hepatotoxic effect. So other one is that it can also induce your cholestatic jaundice, which is your because of the interrupted bile flow. So what happens? Rifin, it compete with the bilirubin for the clearance of the for the clearance. Okay, so is competing with the bilirubin for the clearance, and rifampin, what is not retained inside will be binding to the bilirubin group which are used to exercise a person before having the major now just surgeries, and they kind of cause hepatotoxic effects, exclusively known as hepatitis, because they are caused because the drug caused that, so they are exclusively given the name of hepatitis. So with the process of toxicity, what is happening is your halogen, again, with the process of metabolism in the liver, that is the metabolism process here is specifically your oxidation process by a CYP450 group of enzyme called as CYP. So you don't need to be specific for that. You just can write the metabolism in this blue highlighted area here, because that is not needed actually. Okay, so you can just put metabolism there. So with the metabolism of halothane, they produce a compound called as trifluoroacetyl chloride. Okay, so trifluoroacetyl chloride, they can get scavenged by glutathione, but for some kind of susceptible individuals or hypersensitive individuals, they can bind covalently to the tissue macromolecule. So tissue macromolecule here means your liver proteins. Okay, so binding of this trifluoroacetyl chloride will with the liver proteins produce a compound, something known as fluoroacetylated liver proteins. So these fluoroacetylated liver proteins, that they have the potential to initiate the immune response. Okay, immune response means again the generation of your antibodies and all. Okay, so because of the reaction of antigen antibody reaction, they will be damaging the hepatic cells, and since they are exclusive to your drug called as halothane, they are known as your halothane hepatitis. Okay, understood? So next drug is the tetracycline. This is your broad spectrum antibiotics. Okay, and these are, if you remember the mechanism of action, they are your protein synthesis inhibitors. So tetracyclines with the decrease in protein synthesis. So this can be also happening here in the eukaryotic cell also, apart from your bacterial cells or the cells of the microorganism. So with the decrease in protein synthesis, the production of your VLDL, okay, that is your very low density lipoproteins, will also suffer. So can you remember what is VLDL? This is from your, I think, hematology block, I know. What is lipoprotein or what is a VLDL? What's their precise function would be?
Transports lipid out of the liver cells.
So lipoproteins are those like your kind of your vehicle which will be transporting your lipids or triglycerides from different areas. Okay, so specifically your VLDL, the function of the VLDL is for the transport of your triglycerides out from the liver cells. Okay, so when your production of VLDL fails because of decreased protein synthesis, because you know VLDL, the lipoprotein, will be comprising of both the lipids and the proteins. Okay, and when the protein production succumbs, what will be happening is that your VLDL production will also be less. Okay, and when VLDLs are not to their amount in the body, so the function of the VLDL will also suffer. Okay, that means the function of the VLDL being the transportation, that is the transportation of the triglycerides out of the liver cell, this function will also suffer. Okay, there will be decreased transport of TGs out of the hepatocyte, and the triglycerides will be locked in or retained inside the liver cells. That is kind of your abnormal retention of the lipids in the liver cell. Okay, so there will be retention of the lipids within the cell, and therefore when lipids are contained or retained in the within the liver cell, they specifically induce some kind of fatty changes in the liver, and that is called as the term is given as your steatosis. Okay, understood?
Yes, ma'am.
Okay, so this is very easy. Okay, so this is all we have in your hepatotoxic drugs. This is rather a very short topic. Okay, so I'm telling you again, please prepare yourself with a list of at least 5 to 10 hepatotoxic drugs, and also the important mechanisms of toxicity relating to your hepatotoxic drugs. Okay, so can you remember how was ethanol or hepatotoxic? ethanol co-hepatotoxic metabolism. Can you remember what is happening? What was happening with ethanol so that they were inducing some hepatotoxic changes in the liver? What's the main process through which ethanol was showing the hepatotoxic effect? You have to remember that is through lipid peroxidation.
Superoxide.
Okay, so just remember that. So with the metabolism to the ADH, there will be redox changes in NAD to NADH. Then NADH will induce an enzyme called as xanthine oxidase. This xanthine oxidase produces your reactive oxygen species like your superoxides, and this superoxides causes your lipid peroxidation, which is your oxidative degeneration of the lipids, because you know the cell membrane, they are the lipid bilayer, and when lipid gets destroyed, your cells will be destroyed. Okay, and also they have your the immunogenic aspect also, where acetaldehyde form can produce an immunogenic response. So next drug I think was isoniazid, you know. So how was isoniazid producing the hepatotoxic effect? I'm summarizing, right? So can anyone remember the effect through isoniazid? So with the involvement of
You have right. Thanks to liver protein.
so there is production of toxic metabolites through your amylase and all, and this toxic metabolite cause direct damage to the liver cells. Okay. So next was the paracetamol. So this you have, this is very familiar, I think. So this is through the overdoses of paracetamol, more production of NABQI. So your glutathione process of conjugation will be saturated, and whatever excess of NABQI is left, they will now bind to the liver protein and start damaging the cells. Okay. So next was your which drug? Rifampin. How rifampin cause toxicity?
Elevates bilirubin.
So there are two mechanisms, okay? So you see, one drug can show hepatotoxic effect through not only one mechanism, but through different mechanism also. So one was hypersensitivity induced, and another was competing with the bilirubin for the clearance, because of which the bilirubin level will be elevated and jaundice-like symptoms will be appearing. That is called as a cholestatic jaundice. So next drug was a halothane. The halothane causes effect through,
Trifluoro.
yeah, they with the metabolization they cause production of trifluoroacetyl chloride, and they can bind now to the liver proteins, which is so called as trifluoroacetylated liver proteins, and they will be starting your immuno-
Immunology.
immunologically immunological response and produce particular kind of effect known as your halothane hepatitis. Okay, and the other drug was tetracycline. Okay, so tetracycline is a protein synthesis inhibitor. Being a protein synthesis inhibitor, your protein synthesis also suffers in you to some extent in the human cell as well. Okay, and there what is happening is it decreases the
Decreases
production of
production. VLDL.
VLDL. So VLDL is a lipoprotein whose main function is to transport the lipids out of the cell. Okay, so when lipoproteins are not formed up to their amount because of your protein synthesis being suffered, the function of VLDL will also be suffered, and because of which the retention of the lipids will cause inside the liver cell. Okay, and when they are retained inside the liver cell, they now causes some kind of fatty changes in the liver cell. And what's the term given for that?
Steatosis.
Steatosis.
Okay, so this is all you have to go with the hepatotoxic drugs. Okay, just the list and mechanism of important hepatotoxic drugs is 4 to 5 mechanism will do. Okay, anything you don't, I mean anything you have to ask, or anything that you have not understood? Okay, so this will so please, okay, just go through the list and the mechanism of toxicity. That is all you have to prepare yourself for this chapter. Okay, if you are okay.